growing up with congenital heart disease, I definitely found it very hard to find an outlet at a certain point and fellow survivors. But through the American Heart Association, I found fellow survivors, impactful stories, a network of survivors to become friends with, doctors to rely on, and also being able to lean towards the science in the AHA, I should say. I find that having congenital heart disease, especially there wasn't a lot out there unless you go to AHA as a resource. And so I think it's really just provided an amazing community for me and amazing stories to be inspired by, people to learn and share from. Jen, who's speaking tonight, is an amazing example of someone I found through the AHA, and she is an inspiration to young women like me because she's been able to have 2 kids after having CHD. So I think, you're constantly finding new survivors and new things through science that you wouldn't find without the AHA community. My parents always raised me in the, you are a warrior, you will overcome this, there are no limits. There's you are not in a penalty box, you are not different than the person next to you. Yes, you have limitations. They kind of made it my superpower that I had heart disease, but my message is treat your kids the way you would treat a kid who didn't have something, which I know sounds crazy, but let your kids experience life. Let your kids be kids. Let your kids be adults. There will be challenges. There will be times that, we might get really sick or we have to undergo surgery. But aside from that, the more we can support, our children and also have a healthy outlet for them, I think it's so important because I think that's what gives us, I know for me, my family always treated me just as they treated my brothers, and that made me want to live more, and that made me have a reason to live more. I wasn't bubbled into a box or you can't do this and you can't do that. And I think also, talking about it and being honest about it, because I think it is a trauma, not only for the child, it's a trauma for the parents, the trauma for the brothers and sisters. And being really open about it is so important. And if you need to ask for help, ask for help. So I think, for me, my journey with the AHA started with the Hamptons Heart Ball. I was the 2014 Junior Heart Hero. And then I've been involved with the committee for a few years. I've helped do the auctions and everything. And so I think it's kind of where I got my start with the AHA. So it was really important for me to help bring my story and what I feel is so important in the mission of AHA and about, all the work we're doing with the Heart Association to light in a kind of a different way through my work as chair. Thank you for being part of this amazing journey. Thank you for sticking with us in this crazy time. This last year has been, year plus I should say, has been nothing but a challenge on everyone. This was a moment where a lot of people could have turned away from the mission, and I think people got even more involved. I think, obviously finding through all the research AHA did that there are a lot of COVID cases that are turning into heart disease. I think it also re-engaged certain people. So I thank you for your continued support in this hard time where it would make it easy to turn away. I also thank you for giving me the opportunity to lead amazing webinars with Dr. Zaidi and fellow survivors. And I thank you for allowing me to continue to spread my message and the mission of the AHA. I think the most important thing is I want everyone to have a healthy, happy, positive life because it's because of people at the AHA and it's because of the science behind that the AHA is so invested in that people like me are getting to live our full lives and realize our dreams finally. I support the American Heart Association because they continue to help me be a warrior of heart disease.
Thank you, Christina, for your powerful remarks and for the work you and Ed have done over the past 2 years. The stories tonight are so moving, and it is wonderful to see how supportive this community is in furthering the mission of longer, healthier lives. Thank you to those who generously donated during Open Your Heart. And remember, you can still donate. Every dollar we raise tonight means the opportunity for a healthier future. All right, I can't wait to see Lady A's performance at the end of this evening's program. I'd now like to introduce Long Island's Executive Director, Tara Lee, to kick us off with the medical honoree presentation portion of the evening. A sincere congratulations to Dr. Ali Zaidi of Mount Sinai on this well-deserved award.
Good evening. As Tamsin mentioned, I'm Tara Lee, the American Heart Association's Executive Director here on Long Island. I have the privilege to introduce Dr. Klein, who will be presenting Dr. Zaidi with the Medical Honoree Award tonight. Dr. Klein is a leader in healthcare management and president of the Mount Sinai Health Network. Among his many accomplishments and impressive career, Dr. Klein is also a fellow of the American Academy of Pediatrics and the American College of Cardiology, and has written extensively on pediatric cardiology. He is also a valued leadership volunteer of the American Heart Association and was the Heart of the Hamptons medical honoree last year. Thank you, Dr. Klein, for being here with us tonight and to introduce this very special award.
Thank you, Tara. As last year's honoree, I'm given the privilege of making some introductory comments this year. The medical honoree of the Hamptons Heart Ball has always been honored for their dedication and service to the healthcare of the community. This is someone who is universally praised and recognized. It is, as I think the audience knows, bestowed upon a healthcare leader in recognition of their dedicated support of cardiovascular health and well-being for all New Yorkers, for their respected position in their communities and their passion and dedication to the American Heart Associations and their missions. Tonight, we recognize Dr. Ali Zaidi with this award. The American Heart Association is making an invaluable impact every day, and Dr. Zaidi is a medical leader who is recognized for making an impact on his patients' lives every day. It is my pleasure to stand here tonight to celebrate him, his impressive accomplishments, and his dedication to the Long Island community. This is particularly meaningful for me. For those of you who may know me, I spent my entire clinical career as a pediatric cardiologist. So recognizing a pediatric cardiologist is something that I've desired for a long time to see happen at the American Heart Association. I think the audience knows, or at least realizes, that congenital heart disease is the #1 defect in the United States and is present in approximately 1 out of 100 babies. But pediatric cardiology is far more than dealing with congenital heart disease. It's also helping keep children healthy who have other forms of heart disease, acquired, secondary to medication, secondary to viruses, etc. Mount Sinai, my academic and clinical home at the present time, has long taken a position that being an outstanding leader in cardiology involves education, not only about recognizing and dealing with disease, but about prevention. And any of us interested in prevention understand this has to start in the pediatric age group, and Dr. Zaidi has been emblematic of the need to do this. At this time, we have a very special guest who would like to say a few words about Dr. Zaidi. I think these words, this appearance, will help you understand the context of Dr. Zaidi's career and why we're honoring him tonight.
Dr. Zaidi is my adult congenital cardiologist, and I've been with him 5 or 7 years now, and he's just a wonderful man. He's so compassionate and so caring, and sorry. And he's gotten me through, getting through the recovery of surgeries and being able to have a child, something that so many people dream about but may not be able to do. we have a great relationship together. We joke, we talk about how I've made him bald and go gray. His beard is all gray because of me. And he's just a wonderful man that is so intelligent and caring and thinks of you as his own child.
It is our honor to recognize him in our esteemed American Heart Association community, alongside with other top healthcare leaders who have improved, impacted, and saved lives in the most significant way, and have continued through the support of the American Heart Association to educate our communities. Dr. Zaidi, on behalf of this audience, on behalf of the American Heart Association, on behalf of your patients, thank you for everything you do every day, and congratulations on being tonight's medical honoree.
Good evening. I'm extremely honored and humbled to be the medical honoree tonight at the 2021 Hamptons Heart Ball by the American Heart Association here in New York. I'm tremendously grateful for the recognition, and I thank the American Heart Association for the honor. I know we are not here in person, and even though virtually, I need to thank the American Heart Association for the commitment for fighting heart disease and cerebrovascular disease and raising awareness for these life-threatening conditions, not just in New York, but in the United States. I want to thank everybody at the AHA in New York and in Long Island, and for the public service that the AHA does to improve the lives of people with these conditions. But where this night is special and where it rings close to my heart is because this year the American Heart Association chose to highlight congenital heart disease. This is a field that I remain passionate about. Some of you who listen tonight and watch this tonight may know, and others may not, that congenital heart disease is the most common birth defect affecting children when they're born. It is the most common congenital birth defect. It affects nearly 1% of all births, which means about 40,000 children born in the United States will have some form of congenital heart disease. That's 1 in 100 children. That's not a small number. But where this night is special is because it recognizes the advancements in medical and surgical techniques, where these children with congenital heart disease are now living to be adults with congenital heart disease. Tonight is special for we highlight those kids, those children born with congenital heart disease who are now growing up with congenital heart disease to being young adults. It is special because these young patients, these young children, these young adults live their lives knowing that they may or may not face another operation. It is important because we salute those kids, those young adults, but we also recognize those moms and dads, those sisters and brothers, those grandparents and friends of these children who grew up knowing that they have congenital heart disease. These young kids are now teenagers and adults. So tonight is special because the AHA is helping us recognize these young adults who have grown up with congenital heart disease. It is special because tonight we recognize these patients all over the United States, not just in New York, because they live their lives with valor and bravery, but mostly because they live their lives with a smile on their face and courage in their hearts. To that end, I have to thank one very special person who I met here in New York City through the American Heart Association, Christina. I met her a few months ago before the pandemic hit, thinking we would just sit and talk about congenital heart disease, about advocacy, about why this field of congenital heart disease needs to be highlighted. And very soon I realized that who I'm speaking with is not just another patient with congenital heart disease, but a dynamic young person who started her journey knowing she has congenital heart disease. Over the last few months, I've realized that Christina personifies the very reason why we as doctors do what we do. Christina and many other patients like Christina out there who are now young adults are a testament that babies born with congenital heart disease will survive and they will live their lives fully, and they will work not only to improve their lives, but the lives of those around them, which is why advocacy for congenital heart disease is what we are talking about. To that end, I thank Christina and Ed, not only for what they're doing tonight, for what they've done over the last few months to raise funds for research and education with the American Heart Association, but most importantly, to highlight that young patients with congenital heart disease have their lives to look forward to. I thank you both for being the voice for those children, for those parents, for those friends, for those kids who will become adults like Christina, vibrant and dynamic. And I thank you for taking this message forward. I thank the American Heart Association for allowing us to work together for the last several months. I will end this by saying that those of you who are listening, those children with congenital heart disease, those teenagers, those young adults, those adults who are getting older with congenital heart disease, know that the sky is the limit. To all of you out there, don't stop. Keep reaching for the sky. This is just the beginning. Just take a look at what Christina has done and many other patients like Christina all across New York, Long Island, and the United States. There is much more to come. I thank you all for coming tonight, for donating, for supporting Christina and Ed and the American Heart Association, for supporting congenital heart disease, for advocacy, not just here in New York, but across the country. I thank the American Heart Association once again, from every member to every volunteer, in promoting cardiovascular research and innovation so that we may share many of these success stories in the future. There is much more to come. I hope you all have a wonderful night tonight, and I thank you all once again.
And now I'd like to introduce you to Jennifer Valoy, a survivor of adult congenital heart disease, whose story of hope is incredibly powerful.
Heart disease is something that I've lived with, but it's not controlling me, and I don't let it control my life. I really had a normal childhood growing up. My parents treated me normal. All my friends treated me normal. The only thing that kept me different was having to go to multiple doctor's appointments, long doctor's appointments each year, very thorough. And so I was treated as a normal child. I loved playing sports. Sports was my life back then. I loved softball. With the heart condition, I wasn't able to do long distance things. So really the short distance stuff like softball was perfect for me, and I really excelled at that. So my first heart surgery in 1992, I don't remember much leading into it. I really remember after the aftermath. After the surgery, I just remember bouncing back really quickly. Like children, they're resilient. So I don't remember the pain I was in, but I just remember being able to bounce back really quickly. I received my pacemaker in 1998. I was in 8th grade, and I had gone and it was an in and out surgery, and that pacemaker helps me with my rhythm. My heart would usually drop down to somewhere in the 40s, 40 beats per minute. So at one of the normal doctor's appointments, they picked that up. I was wearing lots of Holter monitors, so they were able to notice that my heart rate was dipping down. They felt the need to put a dual chamber pacemaker in. So I received that in 1998. I still have it today. I had it replaced already, the generator with a new battery. My husband, Brian, we met in culinary school. We both went to culinary school for college. It was a 2-year program down by Atlantic City. We met in baking class. We dated for 11 years, and we've been married. June will be 7 years now. Yeah, we've been together for a really long time, and he's been with me for most of the surgeries now. I'd say 3 of the 4 surgeries that I've had, he's been with me through those. When dating, we knew we wanted to have a family. Later getting married, it was really important to us. We knew there could be complications with my heart. Not sure if my body and my heart could really manage a full pregnancy. It was really important to my husband and I to have a family and to continue. At that time, we did find another OB that we completely trusted and just felt so comfortable with. And he had offered to do some type of blood test, looking over some of my notes and some of my history. He thought, let's just try this and test the blood to see if there was a possible blood clotting disorder. And the test did come back with a possible disorder. So he said, let's try doing injections of Lovenox, which is a blood thinner that you take an injection once a night. We tried that, and actually that did lead to a successful pregnancy. I carried full term to a perfectly healthy baby girl. When you are a high-risk appointment, you get a normal anatomy scan at 20 weeks, but in addition to that, you'll go for a fetal echo. And with that fetal echo, it's really getting to see a close image of the baby's heart. And for me, with my Epstein's anomaly congenital disorder, they were really focusing in on the tricuspid valve. And when we just heard at the appointment that everything looks great, the baby doesn't look like she would have any type of congenital issues, it was just a breath of fresh air and so much taken off of our shoulders, because you're kind of waiting for that bad news, knowing that I have the disease and it could easily be passed on to her. So it was just so wonderful to hear that. We're doing great. Brielle will be 3 at the end of this month, and I feel great. I had an echo a few months ago. Everything looks good so far. My valve it does leak moderately. At this time, I don't need another open heart surgery at this moment. There is one that we will discuss in the near future as this pig valve continues to break down. I'm about 13 years into the pig valve now, so I will need another one at some point. We just, we don't know how long I have on the valve, but I do know that there is another surgery in the future. I currently am 21 weeks pregnant, and we're having a boy this time. We're so excited. We're welcoming our little blessing in September, sometime in the middle of this September. So I have Dr. Zaidi running ragged right now. I'm sure he's going to be completely bald this time around, but I promise this is our last one. I promise. I have one of each. God has been so good to us, so that's it for us. It's important to support the American Heart Association because they bring awareness to all types of heart diseases. Heart disease isn't just for the elderly people or the people that are out of shape. It really brings awareness to all these other congenital diseases that people who are younger have, just like me, from the day one, from the start one of being born. So thank you so much.
TikTok influencer JT Laybourne is a heart survivor. JT has 1.2 million followers and a message all about positivity and kindness. The TikTok influencer and his friends decided to raise money for the American Heart Association, with his friends holding live fundraisers throughout the month of December. TikTok fundraisers by celebrities and others have raised smaller amounts until now.
Going viral for change. This TikTok star isn't just making people laugh or doing the latest dance trend. No, he's encouraging thousands to get serious about heart health. Meet JT Laybourne. His rise to social media fame started with golfing trick shots and evolved into spreading positivity and sharing his story. JT is a husband, father, and heart disease survivor, born with a congenital heart defect. JT had his first open heart surgery at 4 years old and his second just last year at the age of 35. Since that time, JT is using his platform on TikTok to share his journey with his now 1.5 million followers. Devoting his platform to promote awareness of the American Heart Association, JT and his wife teamed up with 2 other couples to raise money for this organization.
What you're going to see is me dancing for American Heart Association.
Their goal of raising $25,000 was shattered by bringing in over $300,000. But it doesn't stop there. JT also teamed up with celebrities like Andy Grammer, Wayne Brady, and AJ McLean from the Backstreet Boys on National Wear Red Day for a live fundraising event. Together, JT helped raise over $400,000 in just one weekend and hopes to reach $1 million soon. JT's story of hope, and is one you can't miss.
I've grown up with my heart issue, and it's been an internal struggle because I've always been one that when someone says I can't do something, I'm going to prove them wrong. This is one of those things that I wasn't able to prove anybody wrong when it came to the limitations I had growing up. It weighed heavy on me. And somewhere along the way, I just started to develop this attitude, this mindset that things could always be worse. And that is something that I've just lived by, and that I'm grateful to be alive. But it could always be worse. So I've always found my heart is full when I make other people happy. And when I bring joy to other people, it's my medicine.
Cheers to a successful event, and congratulations again to the chairs, Christina Chivetta and Ed Sheets, and our medical honoree, Dr. Zaidi. Thank you for your generous support of the American Heart Association. I hope tonight filled you in on some great work happening here on Long Island, and I hope it also gave you a sense of the lives that the work of the American Heart Association touches, and all that would not happen without each and every one of you. I'm proud of our community and of this amazing organization that impacts the health and well-being in so many people in so many ways, and all of us who live here and many across this country and all around the world. Thank you for an incredible evening. Pour yourself another heart-healthy drink. It is time to welcome 7-time Grammy Award-winning Lady A to close out tonight's program. I'm Tamsin Fidel. Thank you so much for having me.
Hey everybody, we are Lady A, and we are so excited to be joining you tonight.
Cardiovascular disease remains the #1 killer in this country, but I know we share the hope that that will not always be the case.
And since we're all here tonight in support of the American Heart Association, we are excited to play a couple songs for you guys. Hope you enjoy.
Stay lit. Make it 20 last like it's 1990. Way out here, where we're from, we don't say ooh la la, carry on. Don't need no bottle service budget. No. Got no money, but we love it. Woo. Reason plastic cups to a life of luxury. C'est la vie on a Friday. Get dressed up in a blue jean tux and we go. Picture perfect memories scattered all around the floor. Reaching for the phone, 'cause I can't fight it anymore. And I wonder if I ever cross your mind. For me it happens all the time. It's a quarter after one, I'm all alone and I need you now. Said I wouldn't come, but lost all control and I need you now. And I don't know how I can do without. I just need you now. Another shot of whiskey, can't stop looking at the door. Girl, I'm wishing you come sweeping in the way you did before. And I wonder if I ever cross your mind. For me it happens all the time. Well, it's a quarter after one, I'm a little drunk and I need you now. I said I wouldn't come, but I lost all control and I need you now. And I don't know how I can do without. I just need you now. Whoa, Guess I'd rather hurt than feel nothing at all. Well, it's a quarter after one. I'm all alone and I need you now. Said I wouldn't come, but I lost all control and I need you now. Oh, and I don't know how I can do without. I just need you now. I just need you now. Oh, baby, I need you now.
Thank you so much for having us and for all you do to make longer, healthier lives possible for everyone. This has been so much fun. We'll see you next time.